do have a lot to cover today, so we're gonna jump in, and I want to be cognizant of everyone's time. Hard to believe this is our final Know Your Rights session. This is the fourth in our series. Tonight we're gonna be discussing mental health in the workplace. It's been such a wonderful collaboration between NAMI New York City and NAMI New York State led, and all of our affiliates have been involved to really promote this and get people involved. But this wouldn't be possible without the support of the Patrick P. Lee Foundation. So we're so lucky tonight to have Jane, the executive director from the Patrick P. Lee Foundation, to say some words about the project. So Jane, great to see you.
Hi, Matt. Thanks for letting me jump in. I'm experiencing some of that winter weather from Buffalo that you were talking about. So I'm just glad that so many people are able to participate, and hopefully everyone's managing the storm well. It's been a long week here in Western New York for sure. But I just want to say thanks everyone for joining us tonight. As Matt said, my name is Jane Magavro, and I have the privilege of serving as the executive director of the Patrick Lee Foundation. For those who are not familiar with the Lee Foundation, we are a private nonprofit foundation based in Buffalo, New York, that focuses on education and mental health. In education, scholarships are the cornerstone of our work, and our primary objective is to help students enter the workforce with minimal debt. The foundation's work in mental health, though, is very personal to the Lee Foundation and Patrick, our founder. The Lee family, like many of you, knows firsthand the struggles families face navigating the mental health care system and the impact dedicated professionals can have on a loved one's care. It was these experiences, both challenging and promising, that gave rise to the Foundation's focus in mental health. Of course, our work is not done in isolation, and to achieve the desired impact, we need strong partners like NAMI who share our vision. I want to recognize Matt, Kim, Haley, and Caitlin for their incredible work on this series, Know Your Rights. These sessions have empowered more than 1,000 New Yorkers by helping them to understand what key services they are entitled to and how best to access them. Since the sessions and resource guides are available online, the program's impact will be ongoing. I encourage you to share these resources with your networks so other families can benefit from this information. And again, thank you to NAMI for leading this effort. We're so grateful for your commitment to our community.
Oh, thank you so much, Jane, and to the Patrick P. Lee Foundation. We couldn't have done this without you, and we're just so grateful for this collaboration to partner with you and your leadership on these critical issues. So thank you so much for joining us. Please be safe out in Western New York. Get home safely, and we will see you soon. And now it's my pleasure. I'm going to turn things over to my colleague, Caitlin, who's going to start with some housekeeping and get us into our program for the evening. So Caitlin, the ball is in your court.
Wonderful. Thank you so much, Matt. So hello, everyone. I'm Caitlin Garbo. I'm the Manager of Public Policy and Advocacy with NAMI-NYC. And NAMI New York City and NAMI New York State together, we are so excited to have everyone here this evening. This is the fourth and final, as we've said, event in the series for Know Your Rights. And so we have some wonderful speakers this evening who are going to be talking about different aspects of mental health in the workplace. I want to invite everyone to join us on the chat. Please share a little bit about what you're most excited to learn about tonight, where you're calling in from, your name, your pronouns, whatever you feel comfortable sharing. We'd love to just see who's here. And we see the numbers are growing as people are joining us. And yeah, so to start off, we're going to be having a main session led by Elena Auerbach. And she will be going over a broad overview of mental health in the workplace and different resources you can access, kind of a foundational knowledge around mental health in the workplace. And then we will be going into a short legal session that is more general, and that will be led by our wonderful Carolyn Reinach-Wolf. And then we will be going after that into breakout rooms. And so those will really be the area where you're going to be able to ask those specific questions the burning questions that you have, and really get to know anything that you want to know about specific areas. So we're going to be breaking out into 3 breakout rooms this evening. One is taking leave from the workplace. That will be led by Mariah Engelberg. Then we'll be going into resources for managers and supervisors, led by Elena. And then Carolyn will go more into legal rights, accommodations, and all of that information in hers. So we're going to hold all of our burning questions for the end. We're going to start off with the main session first. If there's anything that piques your interest that you want to share and let us know, if there's some like broader questions, feel free to share them in the chat. That's totally fine. We may get to them, we may not, so we'll see. But yeah, it's great to see everyone's here.
In the breakout sessions too. So diving right in, when we talk about mental health in the workplace, it's really important to understand a few terms and recognize that mental health is a continuum, because it really impacts how we think about mental health in the workplace. Just in the way that we all have physical health because we have a body, we say that we all have mental health because we have a mind. So that means sometimes your mental health might be really optimal, as you see at the top of the screen here, or sometimes you're stressed and going through a hard time. There may be mental health challenges. A lot of times we think that mental health only refers to the negative things, but really mental health is a normal part of all of our lives. It can be when we're happy because maybe we welcomed a new family member into the world, or when we're stressed, like I mentioned, due to difficulties in life. The World Health Organization defines mental health as a state of well-being in which we're able to cope with the normal stressors of life, realize our abilities, be productive, and contribute to our community. And the World Health Organization also says that mental health is a human right, and it's not merely the absence of disease, but also the presence of wellness. While mental illnesses are conditions in which people's mood, thinking, and behaviors negatively affect our day-to-day functioning. We all probably know this stat, but 1 in 5 US adults live with a diagnosable mental health condition. So the key understanding here is that mental health and mental illness are not opposing conditions. People living with a mental illness, such as myself, can thrive and experience optimal mental health. And conversely, in the workplace, maybe we might be making assumptions about all of the people around us and our coworkers. So it's important to center the individual and realize that we all kind of fall somewhere on this continuum. It may change, and we want to listen to each other as opposed to making assumptions when we're in the workplace. So now that we kind of discussed those baseline terms and how we think about them, what is the relationship between the workplace and mental health? We know for the average full-time employee in the US, half of our lives are spent at work. And of course, we acknowledge that may not be the case for everyone, but the point is that work is integral in our lives, whether we want it to be or not, and it can take up a lot of our energy, our emotions, our time, our thoughts. And since this is the case, work affects our mental health, both negatively and positively. We, of course, associate work with the negatives. We spend so much time there. We're stressed out from something at work. It may keep us from doing the other things we want to do. Maybe we don't feel like we're paid enough. But all of those things are valid. And research does show that the workplace can lead to stress, including chronic stress, such as burnout. It can worsen mental health symptoms and cause physical health issues. So much that you may have to go on a mental health leave or unable to work, which I've personally experienced as well, going to the emergency room. But I like to also note that the workplace can positively impact our mental health. Research shows that having a job can promote recovery and inclusion. It gives us a purpose, a routine, can help us feel confident, like we're a part of something. We get to use our strengths and make an impact. And it's also a place where we can find social support and connect with our coworkers and our community and our customers, whoever it may be that you're around. And in the most basic sense, it can provide financial stability and is very realistically something that we need to be able to function in life. But the impacts, of course, of those positive mental health pieces of work is not equally shared. We don't all have the same access to employment. People living with mental illness, we know, are both employed at lower rates than people without mental illness and are also underemployed, meaning that we may have jobs where all of our capabilities and skills are not being used. Mental health is a diversity, equity, and inclusion issue that shows up greatly in the workplace. Research has robustly and consistently shown that people who experience discrimination can also experience increased mental health challenges from those discriminations experiences. And in addition, people living with mental illness experience stigma and discrimination against us in the workplace, which can worsen our mental health in so many ways, including, unfortunately, making us really fearful of seeking out help in the workplace when we need it. And that can be so challenging because the key to recovery, of course, is hope and feeling like that we can reach out for help. And of course, more generally, some workplaces are just far less mentally healthy than others. For example, if you're going into work every day and getting yelled at by your boss, it's probably going to be hard to say that you feel that your work is positively impacting your mental health. The good thing is that employers are increasingly starting to recognize the importance of mental health in the workplace. According to an October 2022 survey by Willis Tower Watson, 88% of companies took some type of measure to address employee mental health in the last year. And of course, this is part because people are demanding it, but also because employers are starting to see the very real impacts of what happens to your workforce when you don't prioritize mental health. And there are huge costs associated with that. In 2022, the United States Surgeon General, which is the leading spokesperson on public health for the federal government, released this framework, which you see in front of you, that has 5 essentials that they recommend employers use as a guide to support employees, as opposed to just providing basic legal rights for them. Our NAMI-NYC Workplace Mental Health Initiative actually has a collaborative with 15 employers who are looking to do that. And this year we're using this framework to break it down to make organizational changes. And we're seeing more and more employers become interested in learning how to talk about accommodations in the workplace and make sure employees know what their rights are, training managers, talking about and mitigating burnout, and the lots of other topics that will be addressed in our breakouts today. And while this presentation is focusing mainly on what we as individuals can be doing to support ourselves and the people around us, and of course, every step you take as an individual does make a change. As you tell your story, you advocate for yourself, you normalize and destigmatize mental health in the workplace. It's also really important to realize that not everything is always in our control in the workplace. Employers and governing bodies have a responsibility to also take action, and there's so much work to be done. Mental illness is the single greatest cause of worker disability worldwide. This is absolutely shocking to me. I have personal experience with this, but that this is the greater cause than, accidents in the workplace, other physical health issues. It's truly mental illness is the single greatest cause of disability worldwide. And 50% of full-time US workers indicated that they had actually left a previous job, at least in part due to mental health reasons. And that was from a Mindshare Partners report. 8 in 10 workers said shame and stigma prevented them from seeking treatment for their mental health condition. And so it's not just what benefits are available to us in the workplace, it's also about how safe we feel accessing them. Free therapy or other resources isn't going to really make a difference if Someone's scared to seek that out because they think they may be retaliated against or get a bad review, be seeing a reduction in the hours they're allowed to work or other negative consequences. And this, of course, then results in us waiting until something's a crisis, and we don't have another option as opposed to going on medical leave, disability, or quitting because we feel like we can't really thrive and be our authentic selves in the workplace. So the hope of this presentation is to give you some tools to support yourself as we're dealing with some of these realities. And on that note, we can talk about some of the resources to support yourselves and others. All workplaces are different, and there are some common resources to be aware of that your employer might provide for you. These are not necessarily all legal rights, which will be covered later. So I just do want to caveat that. But there are things to ask about, to talk to your human resources team and see if they are available. And kind of demystify what some of these very jargony terms are and how they might be of use to you. So of course, the first is medical insurance with behavioral health, mental health, substance use coverage. This means, if you opt into an insurance plan provided through an employer, you can see certain in-network providers such as psychologists, counselors, psychiatrists at some type of reduced price than if you didn't have insurance. Some insurances will also pay for part of your bill through what's called a super bill, which we don't have a ton of time to get into today. But if the providers you need to see are out of network or if things are not covered within the network. Insurance can be extremely tricky and complicated. So it's always really good to spend some time with your human resources team to learn more, ask questions, and of course, call your insurance to ask questions and find providers too, as opposed to just booking something because there can be, confusion. Some employers also offer employee assistant programs, which are called EAPs. They're separate in a lot of ways from insurance. They are free to employees, and they help you find therapists, psychiatrists, different providers related to mental health. And some even provide free counseling sessions and other support services such as coaching, legal support, remediation. EAPs often are available for family members to use free of charge as well. And they are supposed to be confidential, meaning, if you go to an EAP and have a free session, your employer is not permitted to know that information. Of course, there are caveats to that you should be aware of, but overall, it should be confidential. Some companies have also been recently providing Health Advocate, which is a free service where nurses, doctors, claim specialists, social workers help you advocate for yourself and the proper care that you need, deal with different billing issues, referrals, and more. Another resource in the workplace, which doesn't always come to mind, but is really important, is how much flexibility your employer provides you. So often in your employee handbook, there will list the number of days you have for paid time off, for sick days. A newer thing is mental health days. And there are also the leave policies, which there's more information that will be covered in our breakout later today. And sometimes there are caregiving policies for what you may be allowed to do as a caregiver of someone and how that might affect your mental health. Another aspect of flexibility is how many breaks you get in a day, whether it's formalized, such as mandatory lunch breaks, or culturally, whether it's a company norm to just constantly be going back to back, whether it be meetings or, whatever is being worked on. And research has shown that is very detrimental to our health. Even 5 minutes breaks between meetings in a day can greatly support our mental health. Training education about how to take care of yourself, resources that are available for you can be a great thing that employers provide. Here at NAMI-NYC, we give trainings on topics like I was mentioning about how employees can cope with stress in the workplace, access resources, how managers can better support their team, and burnout. And some workplaces have something called an employee resource group or affinity groups, which bring employees together with shared characteristics to build inclusion. These groups are based on some type of shared identity, race, gender, roles, or things like having a disability or having a mental illness. and they're led by employees. They can be really, really powerful resources in the workplace for you to be a part of because they share support for one another. Of course, with NAMI, we always are talking about the lived experience piece, peers, and community. They also help refer to more resources that maybe have worked for other people in the past and provide support. Within these employee resource groups, or sometimes separate, are mental health peers or champions. And these are employees that have been trained in some type of way to support other employees who may be struggling with their mental health or looking for more resources. We are huge advocates for peers in the workplace because by talking about mental health in the workplace, our stories and showing that we can be there and thrive, it really helps destigmatize and correct the myths that people may have about us. And it also provides hope to others that might be living with mental illnesses in the workplace. And lastly, human resources is kind of like this catch-all central resource typically where you can go and ask about what's available to you, ask questions, how to access them. They're always trained at different levels for mental health, and that's something that we work on too, but it's typically their responsibility. And we won't cover them here, but there are also resources outside of what your employer provides you, whether the workplace can not always provide everything, and their interests are aligned to themselves. That's what they're ultimately there to serve themselves as employers. So it's good to keep those ones in mind and maybe take some from the breakaways today, like the Job Accommodation Network, JAN, NAMI, and other legal rights advocacy options for the workplace. So we just discussed some resources to be aware of that your employers may provide. But the most important step is recognizing that, you might be having some challenges because this activates us to then seek out those resources, which I was just talking about. Part of the challenge in the workplace is that we prioritize work, deadlines, constantly busy, overwhelmed, nonstop, without kind of pausing to see what's going on around us, within us, and what we might want to be doing about that. I'm sure we've all gotten really angry about something at work. I've had negative emotions about work. Maybe, for example, you get an email from someone or your colleague says something to you that really bothers you. And so you respond in a way you send an angry email back. You say something that you probably don't actually mean. And of course, after that all passes, you realize hey, I wish I didn't do that. And it may not have been the best way to serve myself in the workplace. So this is why practicing mindfulness is the foundational step for all of our workplace trainings that we do to support ourselves, because it allows us to notice our feelings and experiences and respond thoughtfully. Mindfulness, as defined by Jon Kabat-Zinn, is awareness that arises through paying attention on purpose in the present moment, not looking to the future or the past, just now, non-judgmentally. And the non-judgmental piece can be very hard because oftentimes when we are upset, especially in the workplace, we can get frustrated with ourselves. So maybe I'm angry about what my colleague said to me, and I just am fuming, and then I start to get upset with myself because I am supposed to be finishing another piece of work that now I'm not doing, and I'm getting frustrated. Why can't I just step out of it and get through it, which is just going to further escalate our negative emotions, and it doesn't really help us respond skillfully. So a great tool that we recommend for practicing mindfulness is called RAIN, and it's developed by a clinical psychologist, Tara Brach. So the first step of RAIN is recognizing. It's the magic moment of awareness of saying, and of course this could be used outside the workplace too, I am angry. Something is happening that is different within me. And the second step is allowing that feeling to happen. So not to judge ourselves, not to try to do all these things to fix it, just allow. Third is investigating. So everyone has their things that may be more common than others for when you are feeling negative emotions. For me, my mind races a lot, my heart races, I get hot, red, things like that. So it's helpful to investigate what you're feeling physically and emotionally. And lastly, and this is the most critical step of it all, is nurturing. So what do I need right now? And not to solve whatever problem is happening, but to take care of myself and get myself kind of out of this emotion mind that I'm in. For me, taking a quick walk, if that's possible, can make a really big difference. Just distracting myself by maybe like playing a crossword for 5 minutes. There's a lot of different things that work for different people. Another way to take care of ourselves in the workplace is practicing self-care. And I know self-care is talked about a lot, but it can be a really great framework for us to use to check in across the different dimensions that you see here listed on the screen to see how we're doing and where we might want to amp up some of that care. And of course, it can change over time. True self-care both protects against negative feelings, which can include, maybe just taking some time to relax and watch your favorite TV show. And it can also be used to enhance well-being, such as exercising and eating well. And this might seem so obvious, but it is really critical. Self-care can give us the foundation of wellness. So when we do get stressed and something bad is happening in the workplace, something bad is happening in our life, which is inevitable, we're in the best shape to handle it. For example, I know when I get under a certain number of hours of sleep, my ability to function and handle things at work is really, really diminished. So as a part of my self-care, I am really adamant about getting a certain number of hours of sleep. So for you all, I'd encourage to maybe just take a moment and reflect on a dimension here that you might want to add to, or something that you're doing well that you really think, that, like I said, for me, sleep is one, and for you, maybe it's another one that you're doing a really good job at and you want to continue. So now that we've talked about how to create kind of this baseline of self-care, how to slow down and become mindful of ourselves when we're not feeling great, we can think about how mental health challenges might show up in the workplace. And this can be challenging because what we see in the workplace are behaviors, and we don't necessarily think that that means something might be going on mental health wise, that we're having a challenge. So some of the common challenges that we see are, of course, a drop in work quality. So just having a harder time to do things to the level that you're used to doing them. Procrastinating or being late about the things that you are doing. Having trouble focusing, making decisions, and getting things done. Absenteeism, which is someone might just be not showing up to work as much as they usually do. And presenteeism, which means when they are showing up, they're not able to be as productive. Poor relationships, so kind of this increase in conflict in the workplace. If you're noticing someone's just like really agitated a lot, or you're agitated a lot, lower morale, erratic behavior, fast and hard to follow speech, and changes in eating and sleeping. So this is not an exhaustive list. And if something like this is happening, that does not mean that you have a mental health challenge or that you have a mental illness or anything like that. It's just a note to start to become aware about what's going on. And we like to talk about this in the sense of behavior changes. So everyone is different. If you have a colleague that is typically very chatty and then suddenly for the last 4 weeks, not chatty at all, that might be concerning to you. And we're going to cover a little bit about what you might want to do to support someone with that. And we don't want to diagnose them, which we'll get into. But for us too, it's just important to get additional help if you're noticing some of these things going on, and address it before it becomes more challenging to address it. Supporting a colleague in the workplace can be tricky because we often don't want to overstep. We don't want to upset them further. We don't know if it's our place to say something, but I know from personal experience of colleagues reaching out to me that reaching out can make an absolutely huge difference. And if you do wind up reaching out and someone says, like, I don't want to talk to you about it, or please leave me alone, or whatever it may be, that's okay. We have some scripts we'll cover that you can say back to that. That's okay. The point is that reaching out can just make someone feel so much less alone. They can feel seen and validated, that they're not the only person that's going through this. And we can get really caught up in what to say, like the exact words. What if we say something wrong? But what matters the most is the act of reaching out and demonstrating that you are there to listen. You may not have the answers. You're not supposed to have all the answers because as a colleague, you're not HR, you're not a mental health professional, but you can be there to provide empathy and to listen. So some good tips to keep in mind if we do want to reach out to a colleague at work is to consider who has the conversation. Maybe you don't really know them that well, and there's someone else that does, and there's a way that you could share with them, of course, confidentially and in a respectful way for them to talk to them. Or of course, in certain scenarios, like HR might need to get involved. If you do have the conversation, you want to be supportive and empathetic. You want to listen more than you're talking and validate their experience. Of course, sometimes it's easy to think that a colleague is overreacting, or, it's really not that big of a deal. I don't get why this is affecting them so much, but it's their experience. And that's 100% true. And there's nothing that, you can't disagree with that. And it's most helpful to just validate that sounds really hard, what you're going through. Asking open-ended questions can be useful to encourage someone to open up. We don't want to judge or diagnose or say, it sounds like you have XYZ. What we want to do is connect them to resources. So if you're aware of resources in your workplace, you might say like, hey, I've tried this EAP before. Do you have the phone number for it? Would it be helpful if I sent it to you? And lastly, you want to thank them for sharing. Can be for anyone who has been in the situation, sharing something about when you're having a hard time in the workplace especially can be so scary and vulnerable. So thanking someone for trusting you and opening up can make a really big difference too. So we have some sample scripts which we'll include in the resource guide that you'll get afterwards, because I know there's a lot here. But some things you might want to use to start is just, we don't want to make people defensive, but just hey, how are you? How have you been doing lately? Just taking a moment to be there. I noticed that like you haven't really been showing up to our meetings. How's everything going? Something like that. When you're responding, you can ask, can you tell me more? Would it help if I looked for resources? What helped in the past? How can I support you? And I already covered this, but if someone doesn't want to talk, there are some scripts that you can say. And we want to avoid things like, well, everyone's really busy. Work is super, a lot going on right now. Everyone's stressed. You should think more positive, and it could be worse. What if you were in this situation? When we're talking to people. So why do we talk about mental health at work? We talk about mental health at work because we want to normalize and destigmatize mental health and mental illness. Talking openly and honestly about mental health at work creates a healthier, safer space so everyone can feel they can be their whole self at work and be respected for it. So I do want to, of course, call out, like, we have additional resources. I know the resource guide will also have like NAMI New York State and a bunch of other resources too, but we have our helpline. We have 40 support groups, which are virtual and in person, including a job talk support group that's truly just for job talk, classes, and more. So I'll hand it over to Carolyn to share for the next 10 minutes of our general session some more about legal rights. Thank you so much.
First, I will unmute. Technology is not my strong suit. Hi, everybody. Elena, that was great. And you actually highlighted some of the issues and challenges that I was going to talk about as well. And we can never hear them enough times. So good evening, everybody. It's so great to see so many people who have signed on to this program. My name is Carolyn Wolf. I actually am a mental health law attorney. I started this practice many years ago after seeing a need for families in particular and individuals who need help navigating through the very complicated and not very supportive most times mental health legal system, the healthcare system. I actually started out as a hospital administrator and then I went to law school. So I've combined some of my clinical experiences as a healthcare administrator with the law practice that we've developed over the years. So I've been tasked with talking about the laws that govern our workplaces. Most major are the federal statutes, the Americans with Disabilities Act, the ADA, the Rehabilitation Act, and states have their own individual employment laws and discrimination laws. The ADA and the Rehab Act and these state laws actually lay out who cannot be discriminated against, which are the protected classes. Among them are the persons with disabilities, and that includes both physical disabilities and mental health challenges. The laws lay out penalties for such discrimination. So according to most of these statutes, people have to be part of a class of people or what's called a protected class in order to be able to utilize these laws. But as with any laws, as with any laws, there are what I call both the legal answers to some of these questions and then the practical and sometimes the common sense answers. The law can't answer all of the questions we have in society. It can't cover all of the difficulties and challenges that we may have in society. So when people ask me, what's the law or what's the legal answer? We try to come up with those as much as we can as attorneys who work in this field, but there are also sometimes issues and challenges that come up that don't really have a straight legal answer as much as what might be a reasonable common sense or think out of the box answer. So the laws specifically direct where there is someone in a protected class, and mental and physical disabilities certainly are a protected class. There must be what's called a reasonable accommodation. And the reasonableness is a term of art in the legal field. We talk about the reasonable person standard. We talk about reasonable under the same or similar circumstances. And in terms of those discrimination laws, reasonable accommodation means just that. So an employer doesn't have to do extraordinary or overly burdensome accommodation of somebody in a protected class, but it must be reasonable. And there are times where there's a discussion or a debate about what reasonable is. Your idea of what reasonable may not be my idea of what's reasonable. So it also comes down to the issue of community standard. What employers in a particular field might deem to be reasonable within a community, for example. A medical center's idea of reasonable accommodation would be different than a warehouse setting, for example, of what a reasonable accommodation could be. So it's usually more specific to the workplace in which people are employed. An employer doesn't have to go to great lengths or overly costly endeavors to provide a reasonable accommodation. But again, it must be reasonable under the circumstances of their particular business model. These laws also require, for the most part, self-reporting. As talented as I'm sure we all are, none of us, to my knowledge, are mind readers. And an employer is among those who are not mind readers. So the laws require that you self-report when you would like to be covered as a protected class and obtain a reasonable accommodation. So that means the person has to share with the employer that they have a disability that requires this type of accommodation. And it's very unclear how much or how little must be shared, because again, the law can't anticipate every possible scenario that people in a workplace are going to have before them. So this becomes not only the legal answer, but the practical answer. And each case is very different in terms of what a person is willing to share or not. Some people are more open about having a mental health diagnosis. Some people are more open about some sort of physical disability that they confront. So again, it becomes not only the legal answer, but sort of the practical answer. And what is the individual comfortable with in talking about to their employer, again, with the goal of receiving some sort of reasonable accommodation. With physical disabilities, it's often obvious what their physical disability is. And it may be easier to discuss that with an employer because, again, it can be seen and observed. But with a mental health disability, this becomes much more challenging. And as has been talked about, we're often faced with possible discrimination, bias, stigma, media, misinformation, and even sometimes personal experiences of the employer, him or herself, which can, of course, lead to a preconceived idea of what a mental health disability is, what it might mean, and then them personally or their business or how it affects other employees, their reputation, and so on. So when I'm faced with addressing this with my own clients in my mental health law practice, I discuss these perspectives with them. And I think this is important to discuss amongst ourselves, with our families, and so on. It's important to talk about the perspectives they have with regard to their own disability. And it's important on both the employee and employer side to be reasonable, but also realistic. Because again, employers don't have to do heroic measures to provide an accommodation. It has to be reasonable. So expectations have to be managed on both sides, both the employer and the employee. And there has to be some meeting of the minds when an accommodation is requested and hopefully granted. An employer doesn't have to jeopardize their business model or their business location to provide an accommodation, but neither can they say nothing would work for them. So sorry, but I can't give it to you. The employer must also evaluate the request and again offer a reasonable accommodation. In turn, the employee has to try to understand their own disability, what can reasonably work or not work for them, and an attempt to collaborate is what I recommend in order to achieve the accommodation that works for both sides. Expectations and reality are often our biggest challenge. Certainly in my own practice, dealing with client expectations, what we can accomplish, what we can't, again, what's reasonable given the question at hand. Sometimes a solution or accommodation isn't possible. Sometimes it can't be all or none, but something in between. So these are all things that we want to consider, and asking for an accommodation or giving over an accommodation as an employer. Again, because mental health disabilities can't be as easily seen as one that is physical, the issue of how much to disclose, which was talked about, how to balance the protections of confidentiality laws with discrimination laws and the emotional realities of these challenges come into focus. All of these things are the realities which have to be dealt with and a solution attempted. We find that an honest and open-minded discussion disclosing what is necessary to make the request and obtain the accommodation, which in turn allows the employer to comply with these laws. So it's a balance on both sides. How much do I have to disclose? But for the employer, how much do I have to adhere to the legal requirements and how much wiggle room there may be? The accommodation in turn allows the employer to comply with the laws, the person to receive the accommodation, and usually it results in the best outcome, but not necessarily the greatest outcome. Again, it's a reasonable outcome. So some examples of requests for reasonable accommodations. Well, someone with high anxiety may need to change the location of their workspace, or with ADHD, lower potential for too much stimulation. Someone suffering from mania or depression, treatment and stability, but workspace and hours, surroundings, fellow employees who work around them may need to be considered and accommodated as much as possible. People who suffer from substance use disorder, such as alcoholism, maybe the employer is willing to provide mocktails or alcohol-free gatherings for meetings and holiday parties, other types of celebrations. Sometimes the creative solution is the better solution while also attaining the legal solution. So it's collaborative, and it's needs to be looked at from a variety of different perspectives. One other thing that I just want to add is, since the pandemic, our workplace has changed significantly. People are not going to the office, or they're not going every day, or they're not going as much as they did before. So now we have the office workplace and we have the virtual workplace. And often the law lags behind what we do in society. So right now we have a society that's working more remotely, that is utilizing space differently. The workplace definition is changing pretty rapidly since the pandemic, but the law hasn't yet caught up with that. So we don't have very many litigated cases to give us guidance quite yet, because of this change in definition of the workplace, physical space, and so on. So stay tuned. So, we can see as the law expands or meets the needs of society in our new workplace world, how the legal system is going to respond to that challenge.
Wonderful. Thank you so much, Carolyn. I really appreciate that mention of that change in the workplace and what that looks like. I'm so intrigued to see how that comes about the next few years, definitely.
So are we.
Yeah.
So are we all.
Absolutely. And thank you again to Elena for leading our the rest of the main session. I haven't seen Elena speak before. I work with Elena at NAMI-NYC, and it's just so amazing to get to see what she does in action. Definitely taking notes on the RAIN method for myself. But yeah, so we're going to move toward our breakout rooms now. You're all going to have a chance to ask the questions, hear more details from all three of our speakers. So I just want to take a moment to acknowledge that we did have a fourth speaker, Natasha Bowman. She works with organizations on their workplace mental wellness and creating healthy workplace environments. She's also a NAMI-NYC board member. And we were hoping to have her join us this evening. Unfortunately, she's not able to be here. But as we've mentioned, we're sending out a resource guide, and we'll have information about how to get to the websites of all four of the scheduled speakers. So you can definitely check out more information there. All right. So I don't know if we have the breakout rooms ready. I know Kimberly might be creating them right now. Great. Okay, so it looks like Kim just opened up our breakout rooms. And we have, okay, so they're labeled. We have burnout. So Elena will be leading the burnout and wellness group or breakout room. And then Carolyn will be in the legal rights and accommodations room. And then finally, Mariah Engelberg from A Better Balance will be talking about taking leave and re-entering the workplace and any benefits related to taking leave. All right, so we're going to invite you to join now. If you have any difficulty joining, please let us know. I'm happy to place you into the breakout rooms. You are able to gain some more clarity around your chosen topic. And it's so great. We've had a couple people trickling back in and sharing a little bit about their experience this evening. And it's just really wonderful to see everyone here this evening and in the past events we've had. I also want to take a moment to just note that any advice or information that we've shared this evening is not formal legal advice. It's simply just a guide to help you get started on your journey. I also want to extend a huge thank you to Mariah, Carolyn, and Elena for sharing their insights this evening. We're so grateful. And I also just want to share really quickly, it's been such a pleasure working with Kimberly, Haley, and Matthew. It's just, they're great people, obviously, like I work with Kimberly myself, but it's just so wonderful to have these events come together. You can see previous recordings of our speaker series. The ones on mental health, housing, and crisis response are on the NAMI-NYC YouTube page, and I believe the one on school-based mental health is on Matthew Shapiro's YouTube page, so definitely feel free to check those out. We'll be sending a recording of this one in a follow-up email along with our resource guide and some other follow-up information. But yeah, so just thank you, everyone. Definitely keep an eye on your email, and thank you for joining us this evening. We'll leave you basically right on time. So thank you, everyone, and I hope that you all learned something this evening.
Thank you, Caitlin, for
Thanks, Caitlin.
organizing this. Thank you.